The clock continues to tick down toward the end of the current legislative session, with every passing day and no real signs of progress on plugging a $1 billion-plus budget hole. A growing number of people are showing up at the state capitol. They're trying to get lawmakers' attention on what another round of big budget cuts will do to core state services, including mental health.
Several hundred people gathered on the south side of the state capitol this week to urge support for Oklahoma's Medicaid program. The Medicaid Matters rally was organized to protest unprecedented cuts proposed for health services funded through Medicaid. Erin Taylor is an advocacy coordinator with the Oklahoma Developmental Disabilities Council.
Let's make sure our legislators are informed of how Medicaid protects vulnerable Oklahomans and is a job creator before they go in and build our state budget in the coming weeks.
73,000 Oklahomans have had their therapies cut in half. We have significantly more who have been affected by the rate cuts and the loss of safety net services.
Oklahoma Department of Mental Health and Substance Abuse Services Commissioner Terri White says her agency is struggling with cuts brought on by the budget crisis.
Everything from over $8 million being ripped out of the safety net period, so those funds aren't there to provide services. Rate cuts at different levels that on average have been about a 13.5% rate cut enacted just this last week.
And White believes additional cuts will mean many services for the mentally ill will simply disappear.
We are talking about, if we're looking at any further cuts, we are talking about the potential loss of crisis centers. We're talking about cuts potentially to the drug courts and mental health courts across the state.
North Care is a mental health facility in Oklahoma City that provides psychiatric evaluation and other services to patients suffering from mental illness. Randy Tate is North Care's CEO.
We're just a little shy of $700,000 in cuts that we've already realized. With the additional things that are going through rules processes, we're anticipating that it will be a $1.4 million budget reduction over the next 12 months.
Tate says they haven't scaled back services yet, but adds the consequences of additional cuts could be grim.
I'm not sure that we will be open. I mean, this is dismal because we do a lot of psychiatry services and a lot of our patients are on medications, and we rely on those Medicaid dollars to make it work.
North Care serves about 14,000 people a year, with Medicaid picking up the cost of about 50% of patients.
So this will be a huge hit to those mental health contracts and our ability to serve people that don't have their own insurance or own ability to pay.
And eliminating those services would have a ripple effect that Tate says would actually increase costs for state government.
A lot of the programs that could be cut are actually going to end up costing the state far more. Because we didn't serve them, they'll end up in jail, prisons, hospitals, and other kinds of institutional care at larger cost to the state.
White says the numbers back that up.
One child in foster care a year, $21,000. One person in the Department of Corrections, $19,000. It only costs $2,000 a year on average to treat someone for their mental illness and addiction. It's much less expensive and significantly more effective.
White says the loss of services already seen this year are reminiscent of what the agency went through during the Great Recession that began in 2008, and she believes the state can ill afford a repeat of those years.
When you take away mental health and substance abuse services, especially during an economic downturn, you can expect to see an increase in suicide. And tragically, that's what we saw when we went through this last time.
Healthcare Authority CEO Nico Gomez has proposed the Medicaid Rebalancing Act of 2020 to avert catastrophic cuts to providers. The plan hinges on increasing the state cigarette tax by $1.50 per pack to provide necessary funding of $100 million. Passing such a tax increase in the legislature would require a supermajority vote in both the House and Senate, something House Appropriations and Budget Chair Earl Sears calls unlikely.
I don't think that will happen. I think what would happen if we run it, it would be 51 votes plus to at least take it to a vote of the people.
Such a vote would not happen until November at the earliest. White believes that would be too late.
If we don't have the revenue source come in that provides $100 million to the Oklahoma Healthcare Authority and $30 million especially to the Department of Mental Health and Substance Abuse Services starting July 1st, we will lose Oklahomans. Unfortunately and tragically, mental illness and addiction are life and death diseases, just like certain other diseases, and people will lose their lives.